Welcome back, folks. This is the BikeFit Physio here with A1 Coaching, and we're talking about common cycling injuries. So last week we spoke about pain at the side of the knee, typically iliotibial band syndrome, so check that one out if you haven't seen it. But today we're going to talk about pain at the back of the knee. So as you know, that there's three hamstring muscles that are in the back of our thigh. They can result in this pain, and also the calf and soleus coming up from the ankle attaching to above the knee can be a source of pain. So we're going to talk about the common sources to pain at the back of your knee, and then we can list out how we can go about helping you with that. So the first one, I would say most importantly, is your knee being too straight at the bottom of the pedal stroke, so just the saddle height being too high. Number two would be having excessive float at your foot and in connection with the pedal, so too much play there can cause pain at the back of your knee. Number three, too much neural tension in your nervous system, and we'll talk about that in a minute. And number four, a sudden increase in your training volume where the tendons have just become too shocked and are unable to keep that level of load without giving you problems. So to go through the main common sources of pain at the back of your knee, so we talked about the knee and the degree of extension at the bottom of the pedal stroke. So typically, a bike fit is a window, and you can be within this window to reduce your risk of these injuries. So what we would say, a static measurement of 25 to 35 degrees at the bottom of the pedal stroke. So that would be the degree of this angle here. So if you find that you're up too high and your knee is straightening out at the bottom of the stroke, then that's the reason why your hamstring, it can be causing you pain at the back of your knee, just because it's being lengthened beyond its comfort zone, and then over the course of the repeated pedal strokes, it'll give rise to pain. Number two, we talked about float. So the reason why you can develop pain at the back of the knee is because the hamstring and the calf, they act like a clutch, and the quads and the glutes are the engine. So the hamstring is always trying to position the knee in the correct alignment for the pedal stroke, and the calf is trying to position the foot. So if there's too much play, then there's too much work for the hamstring and the calf, and basically the tendons become overloaded, causing pain at the back of the knee. So, what you do there is you look at your float. You can get 9 degrees of float, 4 degrees, and then closing in towards 0. So if you find that you're just too much float, try and dial that in using a system, whichever cleat you're using, and see if that makes a difference to your knee pain. Number three then we talked about was neural tension. So this can develop because of many reasons. We talked before in one of the videos about how well you move your lumbopelvic region, so your lower back pelvis. So, if you're not moving too well there, you can create a nerve tension down your leg. So how we assess for that is we call it a slump test. So we get the patient to sit like this. They slump into this position and then lift their leg. So if they find that there's a kind of a horrible nervy tingling tension going down their leg, then they're positive for neural tension. So if then they're repeatedly pedaling on the bike in this sort of this type of neural tension position, then they can give rise to pain through the back of the leg. And number four we talked about was just a sudden increase in your training load. So we know that tendons, they just do not like a sudden change in load. So they like to be just a gradual change, almost like tricking them into thinking that nothing has changed. So that's why there's that 10% rule in the running world, to just increase your training by 10% every week. It's to do with not shocking the tendon and then therefore reducing the risk of pain. So the same goes for cycling. If you've come back from a week in the Alps and you're wondering why you have pain in the back of your knee when you didn't do any preparation work for it, then that's the reason. You've just overloaded your tendons of your hamstring or your calf, resulting in pain at the back of the knee. So just have a look at your training load, follow the A1 coaching, Dave set you right, and go from there.